We're looking at the vertebral column in this lecture. If you remember, there's an appendicular and an axial, so we're focusing on the axial. We're born with 33 vertebrae, but by adulthood, we're down to 26. 7 of these are going to be cervical, 12 are thoracic, 5 are lumbar, and 1 sacrum, and the coccyx. Those last 2 are fused, and I'll talk about those later. Think of eating breakfast at 7, lunch at 12, dinner at 5, and that will help you remember these. Let's look at this video. We're looking at the cervical now. The uppermost cervical vertebra is called the atlas, and it allows us to nod our head up and down to say yes. The axis is below it. The axis has that dens, and the axis allows us to say no, so we turn from side to side. You see the lateral mass there? I don't know if you can see that on the sides. That's where a lot of the weight of the head weighs almost as much as a bowling ball, is positioned on that lateral mass. On the thoracic vertebra. In the thoracic vertebra, we have ribs. And so there's an extra set of facets or processes on there. And it's going to articulate with the sternum. 3 parts are the manubrium, body of the sternum, xiphoid process. Now I know this is coming fast, and that's what this lecture is about. We're going to take each part step by step. Now you'll notice that the ribs are not attached directly to the sternum. There's a costal cartilage, and that allows the expansion and contraction of our chest, and also allows it to, we can take a blow to the chest without being harmed. Nice example here of the articulation with the ribs. Yes. So there's the head of the rib, and there's demifacets there on the spinous process, the transverse process there. And in the thoracic, we see long spinous processes, which are for muscle attachment. All right. Moving down to the lumbar. These are the massive vertebrae that can withstand a lot of pressure. The transverse process, the spinous process, is very thick and stout for muscle attachment. We're going to look at the detail of all vertebrae, really. They all have a body, and they have the arch. Now the arch is the top part that has the pedicle, the lamina, the transverse process, and the spinous process. All those, the spinous and the transverse are for muscle attachment. Intervertebral disc, and there's the articulation. Okay, there's an inferior and superior articular process that allows the spine to be rigid, but there's some flexion as well possible. Okay, thank you, Stanford. Vertebral curvature. Okay, we all have some spinal curvature. Scoliosis is when there's a lateral curvature. It tends to be due to a birth defect. They may have one leg shorter than the other, maybe some paralysis on one side. That's in severe cases. Many of us have a little scoliosis that we deal with. Kyphosis is an increase in thoracic curvature, and we see this in osteoporosis and arthritis of the disc between the vertebrae, but sometimes just poor posture over time can cause this. Lordosis for right. We have lumbar curvature, so that's lower back, often compensating for weight around the middle, such as pregnancy, obesity, osteoporosis, and some hip diseases. We saw a little bit about intervertebral disc. The prefix inter means between. There is a fibrous fibrocartilage that surrounds an internal nucleus pulposus. Excuse me. We are tallest when we wake up in the morning because the pulposus is fully hydrated, but during the day it's compressed, and so when we go to bed at night we're a little shorter. There may be some rupturing, and we call this a herniation. It's also called a slip disc or prolapse. And what happens is that pulposus is going to expand out into the spinal nerves and cause pain, sometimes running down the sciatic nerve into the leg. Often this is self-limiting. That means it takes care of itself, but a laminectomy or cortisone injections may be needed. Laminectomy, ectomy means removal, and they're going to take, the surgeon is going to remove part of the lamina, which I'll talk about later. And here it is. Here's the lamina right here. Take a look. The lamina is part of the vertebral arch, which is opposite of the body. Here's the body. And that's where the cartilage, intervertebral cartilage is. We have the transverse process for muscle attachment. Spinous also for muscle attachment. And then these are processes involved with articulation between the vertebrae. And we'll see some examples of that. And here we have it, yeah. So take a look at this lower diagram. You'll see there's the pedicel. And then here is the inferior articular faucet. See, inferior means it's below. And then here's a superior. And that way we have articulation not only between the vertebrae here, but on the movable side. And so this allows some flexion of the spine, thank goodness. Transverse process, I mentioned, spinous. Okay, we're ready. On to the top, the neck, cervical. In the preview, we looked at the atlas, and the atlas has these bodies here that are going to take up some of the weight. And this is the one that allows us to say yes, nod our head up and down. Below it is the axis. These are very thin, fragile bones, and so neck injuries are a problem. The dens here allows us to say no. And the way I remember these is I try to say first I try to say yes in life. You know, when something comes up, I try to say yes, yes. So first is the atlas, and I say yes. Many of these vertebrae are going to have this bifid branched head on it, or process, the spinous process, but not the atlas here. In severe trauma, this dens is a problem because it's going to be driven into the medulla oblongata and may cause death. Thoracic, now we're down the rib cage, and the feature that sets this off from the other vertebrae are these facets for the head of the rib. There's an articulation there. Let's see if we can see it better here. Sometimes called demifaucets. In fact, here, I wrote it in big letters. Demifaucets here. When you see that, you know you're looking at a thoracic vertebra. Also, look at the spinous process. Long. And its position changes as you go down the spine. And these are the ones you see sometimes when someone doesn't have a shirt on. And you'll see the kind of the bulging heads of the spinous process through the skin. All right, the articulation of the inferior and superior articular facets allow for side-to-side bending in the thoracic region, but they don't really allow for this flexion extension. Okay, that comes later in the lumbar. So here we have side-to-side, lateral. Speaking of lumbar, here they are. Look at the massive body here. Okay, because this is going to withstand the weight of the torso, the head, and it's roughened here. There is the inferior superior articular process, spinous process, and the transverse. Okay, these are for muscle attachment, if you remember, and they're short and thick because there's massive muscles attaching this side for bending the backbone. There are some problems with this region because if you look to the far right, here we have a flexion compression injury. If you were to jump off the roof of a house or take a real heavy load, then you're going to have this problem here where there's a serious injury because not only is there injury to the bone, but remember this thing protects the spinal cord that passes through it. On to the sacrum. I mentioned earlier there's a fusion, and here's the sacrum. Usually they start to fuse together around age 16 to 18, but it doesn't fully ossify until we're about 30. Generally, it shows 5 here, but it's not always that case. Female sacrum is short and wide, and it tends to be curved around S1 and S2. One neat thing about the I like this cornu here, and here's where we inject an epidural. The problem is, as we get older patients, then that ligament, the dorsal ligament, begins to thicken, and the cornu. Let's see. Here's the cornu. If you look at the upper right, there's a better view of that horn-like cornu. See, so this gives you a target. Here's the cornu, and there's the sacrohiatus, where we have access to the spinal cord. Okay, and that's pretty neat because we don't have easy access to the spinal cord and many parts of it. The coccyx, which cuckoo, the word's Latin for cuckoo. It looks like a cuckoo's beak, I suppose, right here. In males, it's curved front to back, so this looks male-like. Females, it's not so curved, probably because it would snap off during childbirth. At least that's a threat. Vertebral regions. Here we have the sternum. In the introduction, it talked about the different regions: the manubrium, the body, and the xiphoid process. The xiphoid process sometimes is snapped off during CPR when we're doing rescue compressions. So we have to position our hands on the body, and you sort of can feel that xiphoid process unless the person's obese or they have jackets on. So be careful because you can drive that deep into the abdomen and cause further problems. Ribs 1 through 7 are going to attach to the sternum with a costal cartilage. And then further down, 8 through 10 are going to attach to 7. And so these are sometimes called false ribs or vertebrochondral ribs. Yeah, that's a new word for me. And here we have the floating ribs down below, that way down, sorry, right here. The head of the rib articulates with the superior demifacet. I mentioned demifacets earlier. Let's take a look here. Right there. That's where the articulation site occurs. Costa cartilage separation. If you recall, the costal cartilage is that tough material. It's non-bone that attaches the ribs to the sternum, the body of the sternum, and the manubrium at the superior position. What will happen is a person may fall and take a tumble, or sometimes just a forceful cough or sneeze will cause a separation at these sites between the ribs and the costal cartilage. Usually there's pain and swelling on the ribs themselves if you palpate them with your fingers, but your patient may complain of like a backache during inhalation. And so they're saying they have a backache, but through years of experience you learn to ignore sometimes your patient's chief complaint and start looking at other options. More serious is the vertebral-costal separation, often due to an auto accident or something severe. All right, study these lectures. Good luck ahead.